You would say, and you said last week, President Obama needs to be more assertive on health care. You also think he needs to be more assertive laying out the plan for Afghanistan moving forward.
Well, look, let's make it very clear that a lot of what the Obama administration has been dealt with now, they've been dealt with by past administrations. Afghanistan is something that arrived on their doorstep with a lot of other things. But they're reaching a point now that, that excuse is going to start to wane. Now you really do have to start coming to Congress and saying, listen, here's how we're going to do it. We might not know with certitude if it's exactly this number, if it's exactly number of months or years, but we need something like that. We had a very bad experience with Iraq, that we had a shifting plans, we had shifting rationales, and I think it's very important that the president also stand up and say, listen to the American people, here's why I'm asking your congressman to vote for this, here's what the outcome might be.
Let's move to health care. I was flummoxed last week when you actually said out loud what most Democrats only dream about alone in bed at night, and that is getting the insurance companies out of the health care business. We just had Chuck Schumer here, obviously, your senator from New York, who said that is just not feasible. Having Medicare for all is not feasible. Do you agree with Senator Schumer? Is that not politically possible?
Well, I've heard the president say the same thing. It would be too much of a shock to the system, and I'm not exactly sure why. For the purposes of each individual citizen, remember, under private insurance, under Medicare, it's the same. You get to choose your doctor. You get to choose the hospital you go to in your neighborhood. So from the perspective of the patient, they wouldn't see much change at all if tomorrow, instead of that bill going to an insurance company, where they, as I said, take 15, 20, 30% off the top in the reimbursement, it goes to Medicare. It goes to the federal government to send out that check. To citizens, they won't see any change at all, except much greater ability to really control costs, and some of that profit that is now going into insurance companies will go back into tax cuts, health care, or frankly go back into the Treasury. We'll save so much more money.
Do you think that's part of the outrage that we saw from progressives last week when there was talk that maybe the president was backing off the public option? Because it strikes me that progressives and liberals feel they've already compromised. Because let's face it, they're like you. They'd like a single-payer system, a totally government-run program. They already felt going for one public option already was a compromise, and now that's gone.
Well, here's what the trouble, and I'll, the punditry will happen on its own. People are commenting on their own, but I'll say this that did happen. When the president laid out his vision for why we needed to do this, at the very top for most Americans is what Chuck Schumer talked about, the need to control cost. Without a public option, now I think you go even further by having no private option, but put that aside for a moment. Without a public option, you've lost the real fulcrum to get costs down. Maybe you still have other ways to cover the uninsured. Maybe you still have other ways to reform the insurance industry, whatever that means. But holding costs down without a public option, you're not going to do it. So it simply becomes a question of what are we really doing here? And if we're not going to control costs, then we're wasting a once in every 30-year opportunity.
Hey,
go ahead.
No, go ahead.
I was just going to say, do you wish the president had actually stood up for the public option? I mean, he continues to say, I prefer it, but that doesn't give you much public option.
I definitely do. I think that, look, there was some argument for saying let Congress massage this for a while, but at a certain point, particularly over this August recess where we're all having to go out, look, I'm in a strange position here that I'm kind of defending 4 or 5 or 6 different plans in addition to my own because the administration hasn't made it clear. I think the time has come for the president to say, here's why we need it, and here's what it means. Because what we're doing now is we're creating a vacuum and rushing into that vacuum where people who are just making stuff up, who are just taking stuff out of broad cloth. This is really where we need the president to be very clear on what he wants, and then we'll fight for it. Now, I want to make it clear, as I've said before in this show, I don't think I have the votes for single payer, to be honest with you. I don't know if there's the votes for the public option right now, but the only way you build votes for something is, well, I go on Morning Joe to build it for my plan, but the president stands up and says, listen, here's why we need this plan.
It's so fascinating with this president. He really hasn't done that. Whether you talk about the stimulus package or cap and trade or Afghanistan or health care, he's let Congress take over. He's stood back. I think that with health care, it is so personal to people. He has got to go there and explain, this is what I believe in. This is why we need it. Follow me.
Because what's interesting is now you see him actually fighting a two-front war, right? I mean, he's fighting progressives saying, okay, all right, fine, maybe we'll have a public option. And then for those who hate the public option and think it means government takeover of health care, he's got to fight back against that argument.
Well, yeah, but I got to say, Joe has a good point.
It's a Democratic battle now, and he needs to
Yeah, but I got to say, I think what we all really need to do is everyone, you're exactly right, looks at it through the lens of their own experience. I think it'd be helpful if we kind of said to people, if you're in this situation, here's what's going to mean to you. For example, if you have private insurance right now at your job, not only can't you lose it because under the bills that are out there, it's 5 years your employer has to keep you there, but there's very few ways that you can do anything except your care improves because that's the way the law is structured. If you have no health insurance, you're going to be able to go out and shop from a couple of different plans, including the public option. It's not going to be free for you, but we're going to provide a subsidy to help you buy it. And if you're on Medicare, Medicaid, the VA, Department of Defense, the Bureau of Indian Affairs, nothing happens to you. So basically, that's what we have to make more clear to people, because people really do look at it. They care about the uninsured. They care about the deficit. They really care about their own family. That simple explanation of who you are and what this means to you, we haven't done a very good job of explaining. But in fairness, we've been buffeted by the nonstop kind of made-up stuff that's been in this debate.
Jamie Rubin, yesterday, Chuck Schumer was on Meet the Press and had this to say about the Scottish decision to allow the Lockerbie terrorists to go free.
Well, I was horrified as well. This is a disgrace, and I think there are two things that should happen. First, I think that our Secretary of State should immediately introduce a resolution condemning those celebrations and calling on Gaddafi to apologize for them. And second, frankly, I'd like to know if there was some kind of illicit deal here. There was a story in many of the newspapers that this was done particularly by the British government in return for getting an oil contract. That would be despicable. These families didn't get over their wounds for 8 years. They never will. And to let this person out, who was one of the greatest terrorists in the last 100 years, was despicable and will be a blot on those who did it for a long time.
All right. Jamie, does this cloud America's relationship with Great Britain right now, that there's a possibility of an oil deal with Libya for the release of a terrorist?
Well, I think it certainly throws a spanner in the works. There's no question that people are troubled by this. But I think the big losers in the long run are not only the families who have to watch this horrifying spectacle of a mass murder cheered, but I think the Libyans shot themselves in the foot. They're basically now reminding everyone of their involvement of the terrorism business.
After several years trying to get back into the
Exactly. And I think in terms of meetings with world leaders, in terms of people's willingness to get involved with Libya, they've set their own cause back for a long time because people will treat Gaddafi with a real hands-off approach for a long time.
Like, for instance, Gaddafi expected to meet with President Obama when he came to New York.
That sort of thing off the agenda, and a lot of meetings have already been canceled. And then I think, unfortunately, the other big loser are those who believe that the international criminal system is currently good enough to deal with terrorism. There's a flaw here. The Scottish trial, the Scottish prison, this was an ad hoc mechanism created in the 90s to deal with terrorism. It's not good enough to have a country like Scotland let this person go, have the families here and around the world look at this terrorist cheered is a disaster for this terrorist. Cheered is a disaster for the idea of international law dealing with terrorism.
And you're right. In the long run, the big loser, Gaddafi in Libya.
Absolutely. In the long run, people will keep their distance from him, and this reminds everyone of his deep involvement in the terrorism.
Right. Thanks for being with us. I appreciate it. Anthony, always great to have you here.
My pleasure. Thanks, John.
When do you see Democrats coming together? You think September? Is it possible?
I think it's going to have to be. It's going to have to be. We need some adult.
This can't be put off till next.
We need some adult supervision, so we need the House to act here. We can't wait for those guys.
Neanderthals in the Senate.
I mean, honestly, this is getting ridiculous over there. So we'll probably have to act and get this country back in order.
All right, you do that. Anthony Weiner, thanks a lot. Appreciate it. Jamie Rubin, greatly appreciate you being here.